Hi, Mom, and my name's Erica. I'm going to be your provider today. Nice to meet you.
Nice to meet you, Erica.
We're going to do a cardiovascular exam. Are you okay with that?
Yes.
Do you have any questions before we get started?
No.
Just so I kind of explain everything to you so you understand what's going on, we're going to kind of do a little sequence. I'm going to take a look at your hands and your neck and your chest. From there, I'll kind of palpate and I'll be feeling for certain things, and then I'll take a listen, okay?
Okay.
All right. So first thing I'm going to have you do is that if I can take your hands, and I'm just going to kind of take a look at your hands, okay? So you're going to kind of feel me feeling around on the fingers. So right now I'm just checking for any kind of signs of clubbing, okay? And I don't see any signs of clubbing. I'm also going to take a look at your nail bed, and you're going to feel me pressing on there. And I'm just kind of taking a look at your capillary refill. We want to make sure that the refill is less than 3 seconds, which it is, so that's good. If you can flip your hands over for me, I'm going to take a look at your palms, okay? So there's no signs of any cyanosis or any abnormal redness. They don't appear to be clammy at all. Everything looks good there. What I'm also going to have you do is if you can bring your hands together, and I'm going to have you push 2 of your nail beds kind of together like this. Great. Perfect. And I don't see any signs of clogging there either, so we're all good. So the next thing that we're going to do is we're going to take your blood pressure, okay? So first we're going to take it with you sitting at this 45-degree angle that you're at now. And then after that, we'll take it again with you laying down just flat, okay? All right, so everything's good with your blood pressure. So what I'm going to do is I'm just going to kind of inspect your chest, okay? So right now, I just want to make sure everything seems to be symmetrical. I don't see anything that looks abnormal there. Okay, good. Okay. And everything appears to be symmetrical here. I don't see any abnormal chest rise. So what I'm also going to do is I'm going to take a look at your jugular veins. So what I'm going to have you do is if you can turn your head to the right, and I'm just going to kind of be looking right here at your vein, just to make sure there's no abnormal distension. And everything looks good there. And if you can go ahead and look straight at me, and then turn your head to the left, and then we'll look here also. Make sure there's no abnormal signs of JVD. All right, perfect. And you can go ahead and look straight. So the next thing I'm going to do is I'm going to start kind of filling around, okay? So I'm just going to go ahead and fill for your carotid pulse. Okay. And everything's there. It's about a 2+, which is expected, so that's normal. And that pulse feels good as well. We're also going to say it's about a 2+. So the next thing I'm going to do is I'm going to kind of feel around on your chest, okay? So this is just me feeling kind of for the different areas of the heart. So we just want to make sure there's no abnormal lifting, that I don't feel any leaves or any thrills or anything like that, okay? Doing okay still?
Yes.
And then everything is good there. Okay. And I'm also going to feel right here. This is called the PMI, okay? So I'm just kind of feeling the same thing. I want to make sure there's nothing abnormal, no lifts, thrills, or any leaves or anything like that. And that feels good there. Okay, great. So the next thing that we're going to do is what we talked about, okay, is I'm going to kind of take a listen. So there's 2 parts of the stethoscope. There's this part that's the diaphragm, this wider area, and then there's also this area that's called the bell. So I'm going to listen to those 4 spots that I just felt around at with both sides, okay? Still doing okay?
Yes.
Okay. If you're comfortable at any time, let me know, okay? Just go ahead and relax and breathe as you normally would. Okay, I'm going to take a listen with the other side, okay? Okay, great. So everything sounds good. I was able to hear both of the heart sounds in all four of those areas. So we checked the aortic, the pulmonic, the tricuspid, and also the mitral right there. So everything sounds good. You don't have any heart murmurs or any extra sounds. The S1 and the S2 both sound normal and fine. That S2 sounds great. There's no splitting, which is good because that means that your valves are synchronized and there's nothing abnormal there. I didn't hear any abnormal sounds, and I would say everything sounds good. Do you have any questions?
No.
Okay. Do you have any history of any heart conditions or anything else that you want to discuss before?
No.
Okay. I appreciate your time, and we'll see you next time. All right?
Thank you.
you.